In this video, we are going to read about recombinant cytokines and their clinical uses. So the recombinant cytokines are basically classified into two types. One cytokine has bone marrow stimulation property, another is used as the immunotherapy. The bone marrow stimulation cytokines are the erythropoietin, clonally stimulating factor, and thrombopoietin, whereas the immunotherapy cytokines are the toll-like receptor 7, interleukin 2, and interferons. First of all, let us start with the bone marrow stimulating cytokines. Let us talk about the erythropoietin. The erythropoietin is the cytokine which causes the bone marrow stimulation. The agent used is the Epoetin Alpha EPO analog, and the clinical uses are the anemias, especially with the renal failure. You have to keep in mind that the Epoetin Alpha is associated with the increased risk of hypertension and the thromboembolic event. So you should really keep in mind about those hypertension and thromboembolic event when using the recombinant cytokine of the erythropoietin. Let us talk about the colony-stimulating factor. The agent used in the colony-stimulating factor are filgrastim and sargramostim. So the clinical uses of this filgrastim and sargramostim are the leukopenia and the recovery of the granulocyte and the monocyte counts are used in the colony-stimulating factor cytokines. Now let us talk about the thrombopoietin cytokine. The agent used in thrombopoietin cytokine is the romiplastim and Thrombopoietin. So these are the two agents that is used in the thrombopoietin cytokine. The clinical uses of those romiplastim and the Thrombopoietin are autoimmune thrombocytopenia. Also, these two thrombopoietin cytokines are the platelet stimulator. Now let us talk about the various immunotherapeutic cytokines that are used. So first of all, let us talk about the toll-like receptor 7. In the toll-like receptor 7, the agent used is imiquimod. And these are used in the anogenital warts and actinic keratosis. The interleukin 2 immunotherapeutic cytokines have the agent aldesleukin. So this is used in the renal cell carcinoma and metastatic melanoma. Now let us talk about different interferons that are used as the immunotherapy recombinant cytokine. The agents are the interferon alpha. The interferon alpha is used in the chronic hepatitis C, but it is less preferred, and it is also used in the chronic hepatitis B also. So the interferon alpha is also used in the renal cell carcinoma. The interferon B is used in the multiple sclerosis, whereas the interferon gamma is used in the chronic granulomatous disease. So in this video, we discuss about the various recombinant cytokine in their clinical uses. Also, we discuss about the agent that is used in the various clinical scenario. In the bone marrow stimulating cytokine, we discuss about the erythropoietin, colony stimulating factors, and thrombopoietin, whereas in the immunotherapy, we discussed toll-like receptor 7, interleukin 2, and interferons. So I hope you understood this topic on the recombinant cytokine and their clinical use. Thank you.